When you think about diabetes, the focus often shifts to blood sugar levels or dietary choices, but the diabetic foot deserves your attention for a different reason. Its unique vulnerabilities, like reduced sensation and impaired circulation, means that even minor issues can escalate quickly into serious complications. My name is Andrew Schneider, a podiatrist based in Houston with over 2 decades of experience. Understanding the diabetic foot is vital for you to take proactive measures in safeguarding your health. By prioritizing foot care, you can reduce the risk of serious issues and enhance your overall well-being. In today's video, we'll discuss what you need to look out for when it comes to your diabetic feet, when it's essential that you get potential problems checked out. But before I do, I wrote a book all about diabetic foot health, and I'd like to send you a copy as a gift. Visit www.diabeticfootbook.com to request your free copy. Also, let others know about these videos. Please like, comment, hit the subscribe button, and share on social media. This will help others find the information they need. When managing diabetes, focusing on foot care is essential, as neglecting this aspect can lead to serious complications. High blood sugar can impair circulation and damage nerves, increasing the risk of foot injuries and infections. You may not feel cuts or blisters, which can escalate quickly if left unchecked. Understanding how diabetes affects your feet empowers you to take proactive steps in your care. By prioritizing foot health, you can significantly reduce the risk of complications like ulcers or even amputation. Remember, it's not just about managing your blood sugar, it's ensuring your overall well-being. Diabetic feet are particularly prone to complications due to the interplay of nerve damage, poor circulation, and skin changes. Neuropathy, a common consequence of diabetes, can diminish your ability to feel pain, temperature, and pressure. This lack of sensation makes it easy to overlook cuts, blisters, or ulcers, allowing them to worsen without your knowledge. Poor circulation further complicates matters. Reduced blood flow impairs your body's ability to heal, making infection and tissue damage more likely. This can lead to serious conditions such as gangrene, which may necessitate amputation if it's not addressed properly. Additionally, diabetes can cause skin changes such as dryness and cracking, which create openings for bacteria to enter. The combination of these factors creates an environment where minor injuries can escalate rapidly into severe complications. Recognizing the unique vulnerabilities of diabetic feet is crucial for prevention. Regular foot checks and prompt attention to any issues can greatly reduce your risk of complication. Ulceration is a common issue for individuals with diabetes, often stemming from factors like poor circulation and neuropathy. Approximately 15% of individuals with diabetes will experience foot ulcers at some point in their lives. If an ulcer does occur, timely treatment and proper management are essential to promote healing and prevent complications. Once a foot ulcer develops, taking immediate and effective action is vital to prevent further complications. Clean the ulcer gently and apply a sterile dressing. Contact your podiatrist immediately to assess the severity of the wound and receive appropriate treatment. Infections can pose important threats to your foot health if you have diabetes, often stemming from minor injuries or ulcerations. Understanding the common types of infections and their seriousness is essential for effective management. When managing diabetes, it's important to understand that foot infections can develop rapidly and escalate in severity if left untreated. Common types include cellulitis, often presenting as redness and swelling, and osteomyelitis, which is an infection of the bone. Both can lead to serious complications, including amputation, if not addressed promptly. To effectively prevent and treat common diabetic foot infections, it's important to adopt a proactive approach. Regularly inspect your feet for cuts, blisters, or redness and maintain good hygiene. Keep your feet dry and moisturized, but avoid putting cream in between your toes. As I just mentioned, regular foot inspections are vital for anyone managing diabetes, as they can help catch potential issues before they escalate. Make it a nightly habit to inspect your feet before you go to bed. Look at the bottom of your feet, the top, and between your toes. Look for cuts, blisters, or redness, and pay attention for any changes in skin color and temperature. Check for swelling or unusual odor, which may indicate infection. Early detection is critical, so don't overlook these signs. If you notice anything, it won't be any more than 24 hours old. You can contact your podiatrist immediately for an emergency appointment. You should watch for any unusual symptoms such as redness, swelling, or warmth in the foot. These may indicate inflammation or infection that requires prompt attention. Pay close attention to any new or worsening pain, as it could be a sign of nerve damage or inadequate blood flow. You may also observe changes in skin texture such as dryness and cracking, which can lead to further issues if left unaddressed. Additionally, notice any unusual nail growth or fungal infections, as these can escalate quickly with individuals with diabetes. Don't forget to check for any blisters, cuts, or sores that aren't healing properly. Even minor injuries can become serious if you have reduced circulation or nerve sensation. Proper footwear plays a crucial role in maintaining foot health for individuals with diabetes. Choose well-fitting shoes that provide ample room for your toes and avoid high heels or narrow designs. Look for soft, breathable materials to reduce friction. There are therapeutic shoes made with diabetics in mind. They have extra depth, especially in the toe box, and minimal seams inside the shoe to prevent irritation. They're covered by insurance if you meet certain requirements, so talk with your podiatrist to see if you qualify. For socks, opt for moisture-wicking, non-binding options to prevent blisters and enhance circulation. Avoid tight bands around the calf, which can cut off circulation. Regular visits to a podiatrist are essential for managing your foot health, especially if you have diabetes. You should aim to see your podiatrist at least once a year, but more frequent checkups may be necessary based on your individual risk factors. During your checkup, you can expect a thorough examination of your feet, focusing on skin integrity, circulation, and sensation. Your podiatrist will assess for any abnormalities, provide guidance on foot care, and recommend appropriate footwear. In managing diabetes, your diet plays an important role in not only controlling blood sugar. In managing diabetes, your diet plays an important role in not only controlling blood sugar levels, but also maintaining foot health. A balanced diet rich in nutrients can help prevent complications associated with diabetes, particularly in the feet. Prioritizing whole foods like vegetables, lean proteins, and whole grains support your overall health and limit blood glucose levels. Limiting processed food, sugars, and unhealthy fats is essential. These items can cause spikes in your blood sugar, increasing your risk of nerve damage and poor circulation, both of which can adversely affect your feet. Staying hydrated helps maintain circulation, which is crucial for delivering nutrients to your extremities. And don't forget to monitor your carbohydrate intake, as this directly impacts your blood sugar. Incorporating fiber-rich foods can slow glucose absorption and keep your levels more stable. Remember, every meal is an opportunity to support your diabetes management and protect your feet. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. Don't forget to order my free book all about diabetic foot health. You can request a free copy at www.diabeticfootbook.com. The link is in the description. If you're diabetic and you think you might have a problem, don't wait. If you're local to Houston, contact us to schedule an immediate appointment. If you live elsewhere, contact your podiatrist immediately. If you're looking for a baseline diabetic foot examination, that's less urgent. Schedule an appointment so we can ensure you have the proper care. The link to request an appointment is also in the description. Thanks so much for watching, and have a great day.